comfortably before you begin. Ideally, you should dilate both pupils to get a clear view. 1% tropicamide given a quarter of an hour beforehand is safe and usually adequate for this. If the patient wears glasses, then generally they're better removed because they often produce reflections and artifacts, and they can be physically awkward during the examination. However, if they're particularly high-powered, then it can be helpful to leave them on because the ophthalmoscope lenses alone may not be powerful enough to neutralize a high refractive error. With the ophthalmoscope and patient now prepared, you're set to proceed with ophthalmoscopy. To keep their eyes steady, you'll need to give them an object straight ahead that they can gaze at with one eye while you're examining the other. Use your right eye and right hand to examine the patient's right eye, and vice versa for the left eye. You can gently place your other hand on their brow. This helps you to steady yourself and also enables you to lift their upper lid when you need to. Now shine the light into the pupil and observe the red reflex. The red reflex that you see is the same phenomenon as the red eye seen in flash photos. It's simply the reflection of the ophthalmoscope light back off the choroidal vessels. In practice, it's very useful for assessing the clarity of the ocular media. Any opacities, such as a corneal scar, a cataract, or a vitreous hemorrhage, are backlit by the red reflex and silhouetted in the pupil. If the opacity is particularly dense, then the red reflex will be abolished altogether. Having looked at the red reflex, you're now ready to examine the fundus. To do this, align yourself about 15 degrees temporal to the visual axis, and you'll be approximately in line with the optic disc. In this position, keep the red reflex in view and slowly move towards the patient. Rack the lens wheel clockwise as you do so to stay in focus as you get nearer. Your primary aim is to identify the optic disc and keep it in focus using the lens wheel. Having found the disc, what do you do next? Well, you use it as your reference point, a sort of base camp for exploration of the rest of the fundus. Look in turn at its margin, its colour, and its central cup. A healthy optic nerve head is an orange-pink colour with a clear disc margin and has a central cup from which the vessels emerge. Having examined the disc, go on now to look at the major blood vessels as they radiate out from it and form the 4 vascular arcades that supply the quadrants of the fundus. You can readily bring each area into view by asking the patient to look towards the quadrant that you want to examine. For example, look up to the right brings the upper right quadrant into view. In order to examine both the lower quadrants, the lid has to be lifted up as the patient looks down. As the final part of fundoscopy, you should examine the central retina lying inside the vascular arcades. It contains the macular region and the centrally located fovea. To bring the fovea into view, simply ask the patient to look directly at your light.